Hi there, and welcome to Lesson 1.2 Health Communication, where we will explore health communication and what we can do to make connecting with our clinicians and administrators easier. In this lesson, we will explore how healthcare communication impacts experiences with healthcare professionals, as well as identify how communication influences decision making. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. After completing this lesson, you will know how being able to better communicate will help you to improve your ability to receive more individualized care. And your lesson takeaways will be to identify the best communication practices, know how to remove obstacles and barriers that may prevent you from having a productive appointment, as well as recognize healthcare's unique languages and how to communicate affects your ability to manage care. Now, in order for us to reach our knowledge goals, this video will first define what is healthcare communication, and then we will learn how to better prevent misunderstandings. Lastly, we will walk through the fundamentals of appointment preparation. So, what is healthcare communication? According to the World Health Organization, it is the focus on the dissemination and the transmission of information exchange between the patient and clinician to influence personal health choices and the improvement of health literacy. As we discussed in the introductory videos, medical practices are now capturing and organizing healthcare data with the assistance of the electronic health record. Since a lot of us don't have the kind of technology that healthcare practices do, let's focus on what we can do to make our communication better and our healthcare appointments more informative. First, let's lay out what are our challenges, barriers, and obstacles that are preventing us from having great communication, as well as an appointment filled with information from our professionals. Here are some of the obstacles in which we find really challenging to control. Number one is everyday life. Let's face it, we're all busy these days. And then we have technology. Although it has so many conveniences, until we are always connected, there will always be room for improvement. And another barrier is money, or lack thereof it. Until we have an unlimited supply of it, the cost of care will always factor in our decision making. I wanted to share with you some of the positive upgrades that Lucy has made to prepare for her appointment and to get all of her doctors on the same page. First, she always prepares for her appointment. Secondly, she utilizes the Patient Better program, and she contributes her work, meaning that Lucy supplies all of her physicians with the same health story. And she makes sure to jot down in between office visits her chief complaints. How this is done is that Lucy documents all of her concerns in between the office visits as they happen. We will talk more about this later. But here is the anatomy of a chief complaint. Each complaint is segmented into 5 separate parts. Number 1, the primary mention, which is what it actually is, the location, the duration, and the severity of it, and the secondary mention. Now let's bring this all home. Lucy improves her communication skills by first eliminating the obstacles and barriers that might affect her office visit. And the night before, she prepares for an activity-driven, effective medical appointment simply by writing down what is ailing her while she is at home. Now let's connect what we have learned so far and take a look at how Lucy is connecting the office visit with her self-management skills. First, she analyzes the layout of the practice and she categorizes services, products, and finances. Secondly, she matches the right professional to the task. She thinks about her questions and jots them down prior to the appointment. Then she determines which staff member would be best to answer her questions based on whether it's clinical or administrative. She knows that all of her communication is going to go to the right person that can help her out the most. And then thirdly, she classifies all the stressors that are controllable and not controllable, simply by appointment preparation. We've covered a lot in our health communication video. Just to let you know, you are well on your way to become an effective and productive self-manager. And that concludes our video for today in healthcare communication and learning what we can do to make the most out of our interactions with health professionals. Join me in Lesson 2.3, where we will look at health literacy and how becoming more proficient in care helps us become more informed decision makers.